Well, hi folks, welcome to Living News 2025 and a happy new year, because last time we saw you was, or you saw us, I should say, was in November last year. So welcome to Living News again. We've got a packed episode again tonight and really looking forward to some of the stuff we've got to present to you. And our special guest, as it's been publicised, is Dr Bindiya, and really looking forward to catching up with her. So,
yes,
Corinne, how have you spent your time since we've been away?
Oh, fantastic. Had a good break and ready to tackle 2025. And I pray it's a really blessed one for you all. And I look forward to sharing with our viewers as well. I'm really excited about today's program. Should we dig into it?
Get stuck into it already?
Yeah.
Well, actually, before we do that, just a reminder that if you want to send a message through, just type it in your chats in either whether it's Facebook or YouTube. Just type the message in, and we'll get that, and we'll correspond back to you with the message if we can. And especially when Dr Bindiya is on, if you've got a question for her, we'll try to respond to that as well. So thank you very much, and let's get stuck into having a look at the recipe for today, Corinne.
Oh, I can't wait.
It's yummy. Thank you.
Hi and welcome back. Tonight we'll be making some low-calorie blueberry muffins. Great for putting in, lunch boxes or taking to work. These ones will have a little bit of lemon in it. We are going to be using two different types of sweetener. So one of them, which Ace will be putting in his muffins, will be the whole earth made with stevia. And then in Diana's, she's going to be using maple syrup. If you don't have any of these ingredients in your pantry, you can just use normal sugar. We will also be using a canola oil. If you want, you can use other alternatives like coconut oil, a light olive oil. I've actually used both and they both taste fine. It's not a recipe that you can actually skip the oil. So there's 2/3 of a cup of oil in each mix, which will make around, say, 12 to 16 muffins. And these are a sometimes, treat, not something that you eat 6 every day. So just bear that in mind. Okay, so we're going to get started. So the first thing I'll get the two kids to do is your flour. You've got 1 cup of flour each, and just pour it into your bowl. Yep. Add your flour. Good.
Can we use any type of flour in this recipe?
You can use, it doesn't work well with almond flour. So I've tried it with almond flour, it didn't work. But you can use, this is a gluten-free flour from that you can find at your supermarket. But today we're just using a normal all-purpose flour, and we've also got some baking soda and some baking powder, so you can add that as well. Add that to yours. We actually need 2.5 cups of flour, sorry Ace, per mix. I'll sift all your ingredients through. Once that's done, we can move on to the eggs. Good. And even if you just sort of hold that there and just bang the side of it. So it gets rid of all those lumps. This helps it to become nice and light, puts air into the flour while you're doing it. Aces will demonstrate that you're still going to get a similar effect, but I would always recommend sifting in your flour. Crack your eggs into your bowl and give it a really good mix. Okay, Diana, we're going to add your oil to yours now. Yep, go.
Should I add this one too?
Yes. Okay, and give it another good stir. Let's add the Greek yogurt. 1/2 cup of the Greek yogurt. Yep, so that's going to go into yours. If you want to use a plant-based yogurt, you can. So there are some coconut ones that you can find, and you can easily substitute that for the Greek yogurt. And now we're going to add your milk. Milk there. You're going to measure out 1/2 cup of the maple syrup. So we're going to do maple syrup. So yeah, half a cup of the maple syrup. And to your one there, yep, you're going to add this because yours is a dry ingredient. Okay, half a cup into your dry ingredients. Okay, tip your ingredients inside, yep, inside your bowls. Good. And to that we're going to add just a teaspoon of the lemon zest.
Is the lemon zest optional?
Optional, yep. Do you like lemon?
Yeah.
Good. Would you like lemon zest in your one? Okay. Put a bit extra lemon in this one. Mix with the red spoons. So mix around just gently. Yep, good. Keep mixing. And then you're going to get a nice thick batter. Feel like you need to add a bit more milk. At this stage we can. And just add a little bit at a time, just as needed. Okay, yep. Yep, that's the consistency we want. So it's a nice thick batter. Just make sure all that flour is combined. So here we've added some flour to our blueberries. It stops the blueberries from sinking all the way to the bottom. So it helps to distribute the blueberries throughout the muffin rather than just all sink to the bottom. So in here we've got 1 cup of blueberries that you're gonna add to your bowl. So, and then we just want to mix that in nice and gentle. We don't want to over mix it. Using your scoop, and just like 1 scoop per muffin tray. Okay. So Ace just likes his muffins plain. He won't be adding any blueberries to it. And that's the good thing about the recipe. You can leave in things, you can take out things, you can add other things. Like if you want to use some other fruits, that's fine too.
Our muffins are now out of the oven and they've cooled down. We cooked them for around 20 to 25 minutes and now we're going to taste them.
Yep. How does it taste, Tiana?
It's really light and airy.
Mm-hmm.
Really good.
Light and fluffy. Do you like blueberries?
Yeah, I love blueberries.
Awesome. Is it something you'd like in your lunchbox?
Yeah.
What about you, Ace? How does your plain muffin taste?
Plain.
Plain.
I noticed you didn't use butter, but it definitely tastes like you did.
Mm-hmm. That's where the oil, so what keeps it nice and moist is the oil and the yogurt. Helps with the moisture.
And this recipe was really simple to make, but it tastes better than most complex recipes.
I'm glad you're enjoying it. And that's all we have for tonight. Thank you for joining us. Good night.
Wow, thanks, Ange and the kids. That was really nice. And it looked yummy. I've got a surprise for you.
What surprise?
I've got one for us to
Oh,
taste.
so Ange gave you a blueberry muffin.
Yes. And guess
Oh,
what?
wow.
I'm always missing out. Not today. Would you like to have a
I
taste?
will. I'm looking forward to having a taste of Ange's blueberry muffin.
And you know what I like
Whoa,
with this muffin?
There you go.
It's like a mixture of me and Dennis. Dennis loves blueberry.
Yeah.
And then you add in the lemon, which is my favorite.
Actually, you can smell the lemon.
Let's have a taste. It's nice.
I like that touch of lemon in it. I really do.
I love lemon in anything.
And Corinne, what about her idea about putting the blueberries in the flour so it doesn't sink to the bottom?
Yeah, that was really good. I like that tip. Yeah.
Never heard of that before.
That is delicious.
Actually. And Corinne, I just wanted to mention to the viewers that we haven't paid Ange to do these cooking demonstrations for us for Living Use. She just does it off her own time and everything like that. And we really appreciate it. And Ange actually owns Soul Food Kitchens, which is a company that she has that does catering and for big events, weddings, anniversaries, all sorts of stuff.
We both used her before, haven't we?
Well, I actually used it at the end of last year because my mum passed away.
I remember that.
And she did Ange catered for at the wake. And you wouldn't believe the amount of comments that we've had from people where the wake is the best wake they've ever been to.
Is that right?
Yeah.
Yeah, it was. I was there, I have to admit. It really was nice. And even the presentation, Johnny, I think, if you make it look very nice as well, people want to eat the food.
Yeah.
So, Ange, thank you for being part of the team. This is really delicious. And you're right, all the muffin is right there. It didn't sink to the top. So that was a great tip. I must try that. And I hope our viewers love that tip as well. This is really, really yum.
Great.
Now I can make some for Dennis. He doesn't have to go to Woolies and buy them.
Well, thank you, Ange and Soul Food Kitchen. And Corinne, what's next?
I have no idea. Let's look. We have Josh, our favorite man, Josh. And Josh has got a new book, but I'll let him tell you about that.
Thank you.
Hi, I'm Josh, back on the Living Books segment, here to highlight another book that I recommend you read. This one I don't have with me today as it is on my Kindle, but you can buy it as a physical book or you can get it as a Kindle. And it is called With by Skye Jitani. And I highly recommend that you read this book, that you reflect on this book, as it's deeply encouraging and gives you a better perspective on our relationship with God. I love the way that Skye writes. It's easy, simple, but challenging and thoughtful. He talks about different postures or different pictures that people have of God and how this impacts the way we live in our day-to-day life. And he highlights 4 different postures that people typically take. Now, I don't want to spoil it here. I want you to really read this book. But he talks about how these 4 postures, while they have elements of truth, and some of them do get part of it right, they're missing the full picture. And the full picture that the Bible gives us is in the title of this book, that God wants to be with us. That is what God desires. And Skye highlights that throughout the book, highlighting scripture, pulling apart passages and parables and how they highlight that God wants to be with us. God desires relationship. And I just love the way he writes. And so I really recommend that you read this book. If you're thinking of reading it or looking for something to read, look at With by Skye Jitani. Now, I just want to share something with you as well. I love to read. I try to get about 50 books in a year. And people always ask me, how do you read so much? And I always think, well, I can read more. But for me, it's a priority. And I used to set the goal, I'm going to read a chapter a day. But then I wouldn't read one day, and then I'd miss the second day, and before you knew it, I was like 7 chapters, 8 chapters behind. How am I going to catch up? And I felt, bad about that. But I changed my setting. I changed my habit. Instead of saying I'm going to read this many chapters or a chapter, I said, you know what? I'm going to read for 10 minutes. If I can read for 10 minutes, however much I read, I'm happy. And so if you find yourself wanting to read, but not knowing where to start or how to start with something small. I'm going to read for 5 minutes today. I'm going to read for 10 minutes today. And set yourself that goal. And however much you read, that's what you read. Set yourself these small habits each and every day. And you'll find yourself reading a lot more books. So I hope that you are inspired and challenged and come away with learning something new. Enjoy.
Johnny,
Yep.
you know that what Josh said?
Yep.
I really like what he said. I'm going to be honest with you viewers. I'm not a reader, but I like how he challenged us to don't put just put a time every day, 5 minutes, 10 minutes. Doesn't sound like a lot to read, and I guess to get us into a habit of reading. And the book We've also sounds like you said, it's an easy, simple book to read. So I think, people should look into that.
Yeah, Corinne, I really like that because that book, when I think about, what it's about, where God wants to be with us, and when you read the Bible, that is consistent. Whenever from Genesis all the way to Revelation, it's about God wanting to be with us, and that's basically the theme of the Bible. And so I really like that that book and how it explains it.
Yeah, you know how last year we gave away some books. I reckon we should get hold of this one.
Yeah.
I love simple reading. And maybe do you reckon we should look into getting one, and we'll give it away to a viewer if you're interested. Why don't you just let us know? And should we put people in a draw? Do you reckon, like we did
like
last time?
Yeah.
Yeah, we
we'll
love
put
to
people in
share.
the draw, and they can let us know, and we'll put your name in the hat, and we'll draw it out.
Yeah, thank you, Josh. I know you love reading. So if you recommend this book, definitely we need to, put it out there and let people know to get into the habit. I love that as well.
That's great. Thank you.
So 2 became 3. Just in case you're wondering, we have invited a special guest. Johnny will introduce the guest. The reason why we have invited this very knowledgeable, beautiful person is, I guess, 5 years ago, I would say 5 years ago, I went on this great overseas holiday. You were asking me how my holiday was, Johnny?
Yes.
I went to the same place. It was a great holiday. Just gotten into the place, and all of a sudden, the whole of my body was hurting.
Ooh, interesting.
And I thought, this is really, really strange. It's really my first week on a holiday. This is not looking good. And it pretty much went through the whole time I was there. And I came back to Australia, and it was the same thing. And there was other things also that happened once I came back to Australia. And to be honest with you, I really couldn't work out what was going on. So I am so happy that today our guest is going to, I guess, educate us on what went on that day all those years ago.
Yeah. So, Dr. Bindiya, welcome. It's so great to have you with us today. Now, for the viewers that have watched episode 13 and 14, and maybe 12, 13, 14, anyway, you would have seen clips that Dr. Bindiya had presented on different subjects. There was one on iron, one on vitamin D, and it might have been the 2. And
they were really good, weren't they?
No, actually, no, there was 3. And the other one was on
preventative care for women, I think.
Preventative care for women, yes. And so it's great, Dr. Bindiya, and thank you so much for your support to our program. We don't pay you to present to do presentations and tell people about things that are important for their health. And so we just want to thank you.
Yeah.
Thank you.
From the bottom of our heart.
It's a pleasure to always be here.
Yeah.
And thank you for having me.
Oh, it's lovely for you to be here. So, Dr. Bindiya, tell me, 5 years ago when I was going through all that and being a bit of depression, a bit of fogginess, what was I going through, do you think? What is that called?
So that is something that we're going to discuss today. It is menopause.
Oh.
And the way you described your symptoms to me just before this, I think that's what you were going through.
Yes.
Especially the hot flashes.
Mm.
Well, I tell you, not everyone gets the hot flashes though. It's not a typical hot flashes all the time for every woman.
Okay.
But it is something that a lot of people do get. And but there are a lot of other symptoms also. So something like, say, hot flashes and then joint pains. Sometimes women come in and say, I've got this brain fogginess. And some say, I'm so irritable and cranky all the time. My mood has changed completely and my family can't cope with it.
I have heard that too. Thank you, Dennis, for putting up with me during that time. Yes. So you named a few, and I heard vertigo. Is vertigo also could have been one of those?
Vertigo is not always the symptom of that. I mean, there could be other reasons for vertigo as well. So it's not part of the actual symptoms of menopause. But when women are going through a lot of these things and they are losing sleep, then vertigo can.
That's a good one. Yeah, losing sleep. I've heard of that as well.
And is it,
so
is it more? Does it affect more in the morning, evening, like when you sleep? I know I hear stories about women want to throw all the blankets off, they get too hot or whatever. Is there a
And
particular
put it
time
back
of
on
day-
2 minutes
yeah,
later.
Is there a particular time of day that it's worse?
So,
or is it,
so a lot of times what women tell me is that during the night,
yeah, okay.
they actually feel a hot flush coming and they're sweaty suddenly. And some people say, oh, my sheets were wet and I felt so hot, I had to take the blanket off, as you said. And then after, say, a couple of minutes, they're okay.
Yeah.
And then they just put the blankets back on and it's gone.
Yeah.
Some people get it a couple of times in a day, and some people just get it once a day, and some people don't get it at all.
So is it something that that just comes and goes like for short periods, or can it last like the whole day?
No, it never lasts for the whole day.
Right.
It's just a couple of minutes in
I'm so thankful it doesn't last the
I was
whole
going to say,
day.
that's comforting news. It's not for days in the day.
The whole day, John. I would be terrible. I would be
So
terrible.
I think there needs to be clarity on what menopause is, when it sets in, how long do the symptoms last for, and what are the symptoms, what are the common symptoms, and how we manage them, basically.
Yeah, that's a good thing what you just said, because
We just had a comment from Elizabeth. Maybe we can have a look at that. With menopause being hormonal, does taking a contraceptive help with it?
So it depends. It depends on the age. It also depends on what symptoms you're getting. There are a lot of factors. So before deciding on one, so it's not like one size fits all.
Yeah,
basically.
Yeah.
So we need to have a good history with your general practitioner, and then we can decide on whether a contraceptive is going to help a certain lady or not.
Yeah.
Right. Okay.
Something also, that was a great question, Liz, but something also that I wanted to ask you. When I started, I'm not going to tell you my age, but obviously I'm not 20 or 30, but can women as young as 30 be going through something? And what's
It
that
is
called?
possible. So it's called an early menopause.
Yes.
And there is a possibility of that as well. Not everyone goes through. So menopause basically can start from the age of 40 in normal menopause, and the symptoms can go up to the age of 50. So perimenopause starts, and from that, usually in Australia, the age is around 45 to 50. That's when the symptoms start to happen. And average 51 is the age in Australia where women actually achieve menopause. Now, menopause, the word itself, it is basically the last period ever that you get. And then after that, it's post-menopause.
Yes.
So post-menopausal means that if you are above 50 and you haven't had your periods for 12 months in a row and no bleeding, and then if you're under 50 years of age, you haven't had your periods for 2 years, and that's when you can say that, yes, I have achieved menopause and I'm postmenopausal.
Okay. So it would be fair to say, Dr. Bindiya, if someone was in their 40s or maybe a little bit around that age, that if they were feeling those symptoms that you were stating before, that it would be a good idea for them to talk to their GP.
Absolutely.
And not rule menopause out.
Absolutely.
Yeah.
So anyone who's getting those symptoms, because hot flushes is not only a symptom of menopause, it could be something else also. But then someone might be going through perimenopausal symptoms, and you go and see your GP, discuss with them, and then. Now, coming back to your question about the 30s, the early menopause that we were talking about. So sometimes some women's hormonal changes happen in a way naturally that their ovaries stop producing the estrogen, which is the female hormone which is required, and that's what drops down, and that's when you're heading towards menopause.
Yeah.
So what happens is that it sometimes it happens because there has been a surgical reason or some medical reason for that.
I heard that as well. Yeah.
So sometimes if someone has had a surgery where there was a need to remove both the ovaries, now that's surgical menopause.
Yes.
in that case, in those early 30s, you don't want a woman to go through those menopausal symptoms for such a long time of 20 years or so. So then when it happens surgically because of some sort of treatment that has happened, when the ovaries were removed, then they actually prescribe you hormones from outside so that the body actually gets those estrogen and progesterone hormones enough to keep the body going normally.
Yeah.
Because there are complications with menopause as well. So what happens in menopause is that the estrogen level of the body, which the ovaries produce, starts to go down, and it completely goes away. Because as you know, the ovaries produce eggs every month. So one egg every month is produced. It's called ovulation. And with aging, that production of the egg or ovulation stops happening. And that's when the estrogen and the progesterone starts to go down. So the levels go down. And this is the setting of the menopause. With the menopause, when it happens, and because those hormones play an important role in the body functions, what happens is that a lot of other systems and organs get affected. So one of them, and the common one, is bones. So osteoporosis, as you would have heard of that, osteoporosis is thinning of the bones. So the density of the bones is reduced once a woman has achieved menopause. And in the first 5 years, that's when the most density is actually reduced in a woman. And after the 5 years, it slows down.
Okay.
So what I mean by the density being reduced in the bone is that they become weak, which means that even with minor injuries, the chances of having a fracture is much higher.
Is that right?
There.
So that's really interesting information. So if there's a viewer out there that's like that, is there something as a doctor you would recommend to your patients to help strengthen the bones?
Yes. So one of the important things to strengthen the bones is we need calcium. The bones need calcium.
Yes.
And for the calcium to be deposited into the bone, we need, and the absorption, we need vitamin D. So we want to make sure that the woman is actually taking enough calcium orally in her diet or with her supplements, that she's getting enough calcium and vitamin D so that they can deposit there. But because estrogen is an important hormone which helps that deposition of calcium and strengthen the bones, that's when it comes in when someone's had a fracture early on during the menopause or perimenopause and the bones have really gone really weak. So sometimes, depending on your other history and your discussion with the doctor, that they actually recommend going on HRT, which is these days it's called MHT, so menopausal hormonal therapy.
Okay.
And that is basically replacing your hormones so that your bones can be strengthened and your other symptoms can go away.
I've got a question about that, but we've got to remember to come back to, there's a viewer that's got a question, but while you're talking about the estrogen, I remember many years ago I went to a seminar with a doctor, and this could all be wrong, okay, so I just want your opinion on it, where he was saying that some people, rather than taking the chemicals or things like that, they're taking more soy and yam to try and boost their estrogen.
Yes.
Is that?
I did hear about
So
that.
there are a few natural products available in the market. Their efficacy is not well known as such, but some of the products have been researched. So before putting someone on MHT or HRT, we do tend to give them, I can't name any products because of reasons because I'm not promoting anything.
Yes, that's right.
But there are products which the doctors sometimes can recommend, and you can actually try those products when you're going through menopause, and they help basically with your. But if there is something which is over the counter or say online, but it's kind of providing you hormones, you should actually consult with your doctor before taking it.
It's something that important. You wouldn't want to go and buy that online.
No.
You definitely want to do your homework, check with someone who's in the know, your GP and things like that.
Can we go to Sylvia's
Sylvia's thing. Yeah, sure.
Sylvia said, would one still get flushes post-menopause?
So once you are postmenopausal, which means that the perimenopause has gone and no period and you're above 50 and everything, most of the times the expectation is that the flushes settle down too. But occasionally I have had people coming in and then they mention that they're getting hot flushes.
Mm-hmm.
In that case, it is important that you actually go and see your doctor and get tested for other things, what could be causing some sweating at night or flushes,
Okay.
basically. Yeah.
So would you, in your with all that knowledge that you have, to help also with menopause symptoms, exercise, is that something that will help?
Yes. So with menopause, what comes is that people say that they start to gain weight.
Yes.
And that is
yes.
the biggest problem. They feel it is difficult to manage.
To lose the weight.
Yes. So what we recommend is that managing your diet properly,
Mhm.
and eating healthy, eating foods
Yeah.
which would be low calorie, less number of calories, reduce your portion sizes,
Yes.
and then exercise appropriately as well.
Yeah.
So exercise could be anything. It could be swimming, it could be walking, it could be going to the gym. Strengthening exercises are more important, which means that you're strengthening your muscles and joints and everything.
Yes.
And it should be done with the type of physical activity that you can do,
Yeah.
depending on your medical history and everything, and you know how you basically,
That sounds good. I like strengthening exercise. That sounds very good for the bones.
Yeah.
Because you don't want to be falling and having a fracture and cause all sorts of things. Johnny, did you have a question you said you wanted to ask?
Oh, that was about the estrogen.
It was about that.
Yeah.
Now,
Okay.
Yeah, go on.
with the menopause, so we talked about the bones, but then there are a few other things which come in and which we need to be mindful of.
Mhm.
And one of the major ones of that is heart disease.
Mhm.
So heart disease is very common, or more, let's say more common in men, but then after menopause, the women get more prone to heart disease
Is that
as well.
right?
Yes.
Oh, that's not good.
And it is really important that they keep an eye on that. And then again, exercise helps, diet helps as well. The cholesterol starts to go up also. So the LDL cholesterol, which is the bad
The bad
cholesterol,
one.
that goes up.
Mm.
Even the triglycerides can go high up
Mhm.
as well, and the good cholesterol, which is the HDL, that goes down. So we need to keep an eye on that also, how your
Mhm.
cholesterol is going. So when you go to your doctors for the annual checkup,
Yeah.
they test you for everything, and they see how things are going there.
Yeah, great.
So, Dr. Bindiya, would you say the heart thing? I didn't know that. Thank you for telling us about that. So, if someone, for instance, has got a good, they are at a good level of the good cholesterol, and the other cholesterol, the bad ones, under control, would you still recommend that they have a checkup of the heart?
Yes.
And what kind of, when you go to your GP, what do you say? Like, what kind of a test would that be called? Do you know what I mean?
So when the heart checkup is done, it's called a cardiovascular risk assessment.
Okay.
In that risk assessment, there are a lot of questions asked. There's a questionnaire which asks about your smoking, your blood sugar levels, your blood pressure, your cholesterol levels, status of diabetes, which is blood sugar levels. Family history of diabetes is important, but it as not as much as how high your own blood sugar levels are.
Yeah.
And smoking is a big risk factor
Okay.
for heart disease as well. So depending on what your history is and what your lifestyle is, they do the appropriate tests for you.
Okay. I see.
Now,
Thank you.
when people get menopause, does it go like for a period of like 5 years or something, and then like starts and then stops? I think I've heard of people where they've had it for a few years and then it's gone away, and then it seems to have come back again, and then it goes away for a few years and then comes back again. Is that normal, or is that not normal?
Usually not.
Yeah,
But
okay.
for some people, when it happens, it could be related to, because it depends on what sort of symptoms they're getting. So it could be related to their lifestyle or their circumstances also.
Yeah, right,
So say,
okay.
for example, if someone is actually exercising a lot and they've been busy with doing things and all that, then those symptoms may have reduced or something. Maybe. But then someone, say, for example, going through some sort of a mental stress or something, and they're kind of going through a difficult time, then the symptoms can go worse as well. So it just depends on that. But normally, ideally, if everything is okay, once the symptoms start, they kind of go on for a certain period of time, and then they stop after that.
Yeah. And I guess this is where the exercise kicks in and helps with, they say, those lack of sleep, or if you have any stress or anything like that, going for a walk, even if you don't want to do other stuff, it's free. Anybody can do it. And the weather is nice at the moment. Dr. Bindiya, there is also another test which we were talking about that they can actually check your bones
That's
density.
correct. Yes.
Yeah.
So it is called a DEXA scan.
Okay.
It's a bone density test, basically. And well, these days there are some mobile buses doing them in conjunction with some GP clinics.
Okay.
So what they do is that the radiology service organizes a mobile bus, and the machine is actually on that bus. And it's a very quick thing. So you can actually ask your GP that if something like that they're doing, and then it is Medicare rebateable for some people as well. Usually, a medically indicated scan, DEXA scan, is done when if someone is above the age of 70, or if someone has had a fracture with a very little injury when it was not expected. That's when it kind of triggers the request for a DEXA scan, and that for that scan you get a Medicare rebate. Otherwise, if somebody wanted to do it privately as well, they could actually request and discuss that with their GP, and that can be done privately.
I think that's a good thing, isn't it? Because they can get a fair idea of the health of their bones, because we can't see them. So that's good advice too.
And there is something else also to consider. So breast checks and mammograms. So mammograms are so we are in Victoria, so Breast Screening Victoria. They offer mammograms every 2 years to women free of cost. So it's totally Medicare rebatable. And then when you reach the age of 50, you should start doing them regularly.
So what's the link between the breast and the menopause and the mammogram?
So because the hormones change, the breast tissue changes as well, and then we need to keep a better eye on that. So with that, also when someone has achieved menopause, so they're postmenopausal, you need to still keep going with your cervical screening test, so which were called pap smears before.
But
That's
now
what we spoke about last
time. We did.
Yeah.
And they're called cervical screening tests now. It's done every 5 years now, and the good thing is that there is a self-collection option as well. So but you still need to go and see your GP, discuss that with them, and if they feel that it is safe and appropriate for you to do it yourself, then they give you a form and they tell you how to do it, and then it can be done easily.
Yeah, you did mention that last time, and I think if any of the women watching tonight, there's so many great options for you, because I know in the past women would say, oh, we don't want to do that, we don't like the test. It was really uncomfortable. But look, if, like you said, if you see your doctor and you can do it yourself, I really would encourage you to go and do all those tests, your breast screen, your mammograms, everything, just to keep on top of things,
There's a comment there, menopause sounds like PCOS.
What's that?
What's PCOS?
PCOS is polycystic ovarian syndrome, but it is quite different from menopause, I would say. Menopause, all the eggs are finished and everything is done with the ovaries, whereas with polycystic ovaries, there's so many multiple follicles there, and it can be managed, and people can still, have their periods after that too. So, and it happens more in young age than in an older age group.
Oh, wow.
I just want to pick up on something that you said before, Corinne, about lack of sleep. Because I know with my own experience, a few years ago when I was not sleeping, I went through a bit of depression.
I thought you were going to say you went through menopause.
No,
Oh, Johnny.
but you know, lack of
Yes,
sleep, and you're talking about
depression.
menopause, you know, getting hot at night, you're not sleeping
Yeah,
very well,
yeah.
you know, and I'm wondering about how the impact of depression happens with this situation.
Look, from my, is it okay? if I
Yeah,
answer
yeah, go
that?
for it.
From my personal history of that, it's really bad because not only you don't understand what's going on, and by the way, now some information that I got on menopause, which I wish I had years back, they came from my private health. There's so much talk now these days about those things, you know, and I'm really happy about that. They send some emails about what to do, what to say. So back in the day, I feel like there was not information out there. Actually, I would say the majority of the people before my time would actually probably say that as well. In the emails, they said it was about 85% of women who they surveyed said they had no education of where to go. And I'm thinking it's something that huge. We have that many women on this planet. How can there be little talk of that? So depression was something that I went through. And I remember, Johnny, what really helped me. And by the way, you try so many things when, you know, you just don't know what's wrong. And then somebody will say something you would try. But in the end, I recognize it was a bit of anxiety and depression. And I did you probably heard of the DARP program.
Yeah, the Depression Anxiety Recovery Program.
Yes, I did that. And I learned so much in there, which helped me with my sleep was one of them also, because obviously I'm a very good sleeper. So just missing out on the sleep alone was very, very bad for me.
Yes. So any life-changing circumstance or event can actually cause anxiety also. And on top of that, if the chemicals are changing in the body and the way the brain responds to everything, so things like that happen. And a program like that helps quite a lot, because you can actually learn about strategies how to manage that, and you know, cognitive behavioral therapy and things like those, where they tell you how to perceive something and then how to actually you know, respond, how the body responds to that outside trigger or action. So it helps quite a lot. So that program, something like that, is really helpful.
Yeah, you're right. It is.
I might just put a plug in for DARP actually, because
sure, go ahead.
My understanding, statistically, the DARP program is has a high success rate of all depression programs.
Is that right?
Worldwide.
Oh, I'm so glad I did that.
And this program runs around the world, all over the world. And so if a viewer wants to know more about DARP, contact us on Living News, and through private message or just in a general message, and we'll get back to you on how you can get hold of DARP, or just look it up on the internet. DARP, DARP, Depression and Anxiety Recovery Program, and you'll find a location that is happening near yourself. So good program.
Maybe because we know we're running one here in a couple of months, we can, I don't know how that works. I'm not very good with all this stuff, but maybe we can put it on our Living News page somewhere, or our Facebook page. I would encourage you, if you're feeling like I felt, and you know, you almost feel like guilty because you think, oh, I'm not depressed, I've got a good life. But like you said, with all those changes having come all of a sudden, it was really overwhelming. And this is one of the reasons I wanted to share with the audience today, because there's no need for us women to suffer in silence, thinking something is wrong with me. I keep forgetting stuff. I used to be really, you know, with it. As you can see, it's something natural that happens to us. And some people have a better menopause than others. But if you're needing help, like you said, Dr. Bindiya, reach out to people, to your GP.
Yes.
Yes.
So never keep it to yourself. Never hesitate to discuss that with your health practitioner. And you should always mention, don't ever think, oh, maybe it's not that important. Maybe there's no you know, treatment for that or anything. There's always help available, and you can always discuss with your GP.
Yes. Absolutely.
I've got another question there by Gizmore. He's saying, can a person in their 20s experience menopause? If not, is there any condition they will be suffering from if they miss their monthly period for more than a year while they're not pregnant?
So the answer to that, simple answer to that is that no, it is unlikely to have menopause at the age of 20, unless it is something that we mentioned that it is because of a treatment to something else that has happened. But otherwise, for the next half of the thing, I think it's important to discuss with your GP and let them assess why this could be happening, because there are a lot of other reasons which could actually suppress the periods, and then you should actually get it all investigated.
Okay. I've got a question. Is that okay? If I
Yeah,
ask one
of
more?
course.
We talked about being able to test the level of estrogen in the body.
Yeah.
Does that give us an indication or not? What stage?
Yeah, that's a very good and common question.
Yeah,
actually.
you know what I mean? Where are we at?
Yeah. We get that a lot, because the first time a woman thinks about, oh, maybe I'm going through perimenopause and let's go and test our hormones.
Yeah.
But then when it is perimenopause, the hormone levels don't actually tell you much about it.
Oh, wow.
So if you are, let's say if you've not had your period for 6 months or a year, that's when we tend to test one of the hormone levels, and that one is quite important there because it tells us about whether the function of the ovaries, whether they've stopped to respond to the follicle stimulating hormone FSH that we commonly call it.
Okay.
So if as I said, that everything else is okay and no other medical illnesses or anything, and we're just talking about this, then that particular hormone can be tested. Sometimes because of other reasons, we tend to check the estrogen and progesterone levels also, but estrogen mainly because some women want to know that it's not medically indicated as such to do that, but sometimes we test it to see if the estrogen level is going down or has actually gone down as well. So yeah.
Okay. Great answer.
Yeah. You have a question? I've got.
You go.
You go.
I'm so glad that you have questions. That's so good, Johnny.
I've got another question. You hear so much on the health thing these days, health and well-being, about the gut and the power of the gut and how you've got to look after your gut microbiome. And and if you look after your gut microbiome, it helps so many other areas of your life or your body. How does a good gut microbiome affect menopause?
Right. Okay.
I told you I was going to throw you independent.
You did. Or does it?
So what it does is mainly because there is so much changing in the body with the hormone levels going down, and then the dietary requirements change as well, and because the weight gain and everything we're going to manage with exercise and diet. So having a good gut microbiome, what it helps with is that all the essential vitamins and minerals and nutrients are absorbed better in your body. And then your immune system also works much better when there's a good gut biome, because they produce enzymes which are good for your body. And then if the gut biome is healthy, then it indirectly helps with everything in there.
So how do we check that gut biome?
We're not going to get there today.
It's pretty involved.
That's for another
segment.
It's a completely different domain there.
That's tough enough. Menopause.
To menopause.
Okay, so it does.
So
really,
short answer to that is I don't think we should actually start thinking about checking the gut microbiome or something.
Okay.
I think we'll just leave it.
We'll stick with the rest.
Yes.
Yeah. All right.
Yeah.
Is there anything that you think that we haven't asked you that you think will be valuable information for our viewers, or something you'd like to say to them?
You mean related to the menopause, or just
related to the menopause?
Yeah. So look, as we discussed before, that the symptoms can start as early as 40.
Yeah.
And the average age is around 45.
Yeah.
So to stay healthy and stay on top of everything, the changes that are happening in your body, first of all, it's always good to see your general practitioner and get medical advice from them. And then if they give you any referrals for testing and everything, get that done. Also stay on top of your preventative tests also, like cervical cancer screening, breast screening. People above 50 should get their bowel cancer screening done as well. We should also get into something which would help with our anxiety or something which comes in with these things. Say, for example, having a spiritual group or path, having some meditation techniques and everything, and that tends to calm our mind down and everything. So it's like a holistic health thing rather than just for being focused on one thing. And exercise every day, no matter what age you are. Exercise is really good.
Great advice.
Well, thank you so much, Dr. Bindiya. It's been great having you.
It's a pleasure.
We've still got some other stuff to cover in the program today before we finish up. But it's just been a real pleasure having you and being able to answer all our questions, even the spanners and curveballs that we've thrown in today.
Yeah, and I must say, in such an easy to understand way as well for us to put into practice.
Thank you.
Yeah, thank you so much.
And don't forget, if you want to hear more from Dr. Bindiya, watch our next episode. Every episode, Dr. Bindiya does a segment, and a little bit shorter than today. Today was a special one. The segment's a little bit shorter on health, but
and it's not live either, so we will get back to them because the next one most likely will not be live.
Well, the show will be live, but the health
talk won't be live. Yeah, sorry, that's what I meant to say. Yeah, but still send your questions through, and we'll pass it on to Dr. Bindiya.
Yep. Anything else? That's it.
That's it. Thank you for having me here.
Thank you so much.
Well, just don't go quite yet, Corinne. We've got, because of the subject, you've chosen a special song.
Yeah.
You want to tell us about that?
Yes, and I just want to give a big shout out to Sibel Kute, who she's got some wonderful videos online. And I chose that one for a few reasons, obviously for the lyrics, but even it's in nature. And you talked about, you know, the whole idea of taking walks and things like that, exercising, and I think, and reducing stress. And where that video was shot was in nature. And as you will watch it, you will see that where she's standing is really solid ground, right? And yet around her, it looks like a really, what can I say? It like, you know, there's waves crashing. So it made me feel like you know, like menopause, you know, there's things going on around you. But if you've got the right advice from your right GP, and if you're on a good, you know, relationship with God, and like Dr. Bindiya said, you are present and you are also doing things to help yourself. Doesn't matter what's going on around you, you can be calm. And she's there on a rock singing these beautiful calm songs, and I just thought it tied up really, really well. I hope I'm explaining myself properly here.
You are.
It can be a hard thing going through menopause, but knowing that you have God that listens to you, like a higher power also, it really makes all the difference. So I hope you enjoy that song. And thank you, Sibel. It's beautiful, beautiful song. Listen to the lyrics.
Let's have a look.
The still small voice of his word, God still speaks. Through the chaos all around, God's word can still be found. He still speaks. To put on his armor, clear away the fuss. We've got to clean away the clutter from our lives. He still speaks in the still small Omega, who was and is to come. Are you walking in his way? Does his lamp light up your path? God still speaks. Have you felt his loving heart? Do you share his words of life? Do you stop and smile at people in your street? He still speaks through the chaos of the world. God still speaks. He still speaks through the pages of his word. God still speaks. Just open up your heart. He still speaks.
Well, what a beautiful song. God Still Speaks. I really love the words of that song because, you know, I believe that God's speaking all the time, but the question is, are we listening? And I remember a few years ago, I was going through a very difficult time, and God spoke to me in the Word. Through different Bible verses in the Word of God, He spoke to me, literally exactly what I needed at the time. And so I just want to encourage you that God does speak still, and we need to listen. Karen?
I love what you just said. Sometimes we get so busy and rushing through the day, and we say we didn't hear God's voice. He was talking, but we weren't listening. Sibel, thank you for reminding us that God still speaks.
Amen.
And yeah, we just need to take the time, all of us,
Yep.
to look after ourselves. Ladies, go and get yourself checked. If you know a daughter, a neighbor, or someone that, you know, yeah, needs to get some checkup done, encourage them. And I just loved having Dr. Bindiya on. She's just so lovely and so
Yeah.
knowledgeable.
Yeah.
We're very blessed to have her on our team.
Yep. And just want to encourage you, our next episode is on March the 14th, Friday, 8 p.m., March the 14th. And we've got another packed show. And we've really got some exciting stuff. We're going to have a few people that we'll be talking to. It'll be a really good program.
Lovely.
Yeah.
Well, thank you all. Thank you, Josh. Thank you, Angie and the kids. Thank you all for making this program such a beautiful program. And we pray that you've been blessed by it. And
don't forget, we want to thank you for our crew, for
yes,
Jamuka and Danubia and
Sam.
Samantha. Just want to thank you for the work that you do behind the scenes. And this wouldn't happen without you guys.
Yes.
And it means so much. And we've had some great feedback from people about the programs. And, you know, that's because of you guys in the background. So I really appreciate it. And thank you.
Yeah, thank you, guys.
Don't
Until
forget-
next time. Don't forget.
Don't forget to
There's
share.
more.
Don't forget to share Living News with other people, because you don't know who needs to hear this information. Now, like tonight's program, there may be, you know, somebody out there that's really struggling with menopause, but you could share this program with them. And so there's all the buttons there. There's a button way over there that says share, and like us as well, because you know, if we keep the likes going, then that keeps us on air. And so thank you very much. Really appreciate it, Corinne. And thanks again for your co-hosting.
Thank you, Johnny. It's always nice to co-host with you.
Thank you.
Until next time, stay blessed, stay close to God, because He still speaks.
Amen.
God bless you. Bye.